You've done more than 10,000 surgeries. What does it take to be such a successful surgeon?
Till you actually get into MBBS, you don't have a perspective about what medicine is.
What is the most rewarding aspect of being a plastic surgeon?
There was hardly any training that we had during our plastic surgery residency. Operating on celebrities comes with its own challenges.
What has been the most fun trend that you have kind of treated?
And surgery is not easy. It is something where you have to get your hands dirty. There is no other way you learn surgery.
Hello and welcome. Today we have Dr. Parag Telang, a well-known plastic surgeon in Bombay. Dr. Telang has done over 10,000 surgeries and has a thriving practice in Abu Dhabi as well. Today in Behind the Scrubs, we are very excited to have such a renowned surgeon, and I'm sure our audience of young doctors, young medical professionals will learn a ton from him. Thank you, Doctor, for being part of Behind the Scrubs at Knya.
The pleasure is all mine, and it's always good to share knowledge and share our journeys.
So, Doctor, before we get to plastic surgery, could you just share a little bit about your early years of medicine, your MBBS, why did you pick surgery? Just share some light on your early years would be helpful.
So both my parents are doctors. They are retired now, of course. Becoming a doctor was something which was always on the mind. And then, of course, when I secured a rank in Grant Medical College, that was also my father's college. That's where he trained. So it was a very exciting phase of life. And then till you actually get into MBBS, you don't have a perspective about what medicine is. What you see on the outside is totally different from, being actually into the wards and seeing the patients and managing the care of the patients. So internship is actually, I feel, the first place where we actually get in touch with clinical side of medicine. Till then, it's more theory than the practical aspect. And then, of course, surgery was something that I always used to like. Plastic surgery, of course, came much later on in life. You first have to do your MS in general surgery, and then there is again an entrance exam, and of course it depends on what rank you secure in the entrance exam. So between my MS in general surgery, which I did from Lokmanya Tilak Municipal College, and the MCH, there was the intervening period of around 5-6 months. So during this time, I got the opportunity to work with some good plastic surgeons, and I saw the meticulousness with which they used to operate, the finesse of these surgeries, and that's when I got attracted to plastic surgery. So plastic surgery happened way later on in life. The initial idea was just to become a doctor, and the specialization happens later on.
Awesome. No, of course. Within plastic surgery, right, I think there are two types. There's primarily cosmetic, which I think is popularly what people perceive it as, but there's also the reconstructive surgery, right? Could you share light on both? And I'm sure the viewers will be curious to know your preference if you have any.
So when we train, like I trained in Lokmanya Tilak Municipal Medical College, where there is a huge trauma ward. So as trainee plastic surgeons, we all train mainly into reconstructive work, which includes facial injuries or fractures of the face. It includes trauma to the hand and reimplants of amputations of hands or fingers. So that is the core curriculum or the core thing in which we all train. So even me, when I graduated in plastic surgery, I was doing a lot of reconstructive work, microvascular surgeries, like free flaps for onco reconstruction and stuff. But after my plastic surgery training, then I was fortunate to get 2 fellowships. One was a fellowship in facial aesthetic surgery, which was in Ghent in Belgium, and the other was a fellowship in ear reconstruction, which was in Paris in France. So both these fellowships completely changed my perspective towards plastic surgery, and I realized that aesthetic surgery is what I really want to focus on. And of course, when I was in Paris, I never thought that there would be so much awareness of aesthetic surgery back home in India. And to my pleasant surprise, it's a myth that cosmetic surgeries are only for celebrities or for Bollywood people. You'll be amazed to see that everyone has the aspiration these days to look good or to feel good about themselves. So cosmetic surgery is a major part of my practice now. So 90% is cosmetic. I do 10% of reconstruction, mainly ear reconstruction. That's what I focus on.
Awesome. I think spoken of a very interesting point, right, about people want to look good and feel good. It's a point which I'd like to come later in the conversation as well, but for now I would like to focus on your journey. So doctor, you've done more than 10,000 surgeries.
Yeah.
That's a very large number. What does it take to be such a successful surgeon?
I mean, it's all got to do with two things. One is you should have the faith in your own abilities, and secondly, patients have to have faith in your abilities. Both things are very important. Having said that, during the plastic surgery training, I worked very hard in the sense there were too many patients to take care of at Sion Hospital, and we were all very busy all the time. And I've tried to maintain the same pace of work. So even till today, I do at least 3 to 4 surgeries every day, and then it's followed by OPD hours. So it's a tough journey, but that's how it is.
You said something interesting, right? You said you were at Sion Hospital, right? And the diversity of patients you saw was a lot.
Yeah.
Do you think that doctors that come out of India or surgeons that come out of India are just, in some sense, just significantly better because of the breadth and experience you see? You have a thriving practice in Abu Dhabi. You probably have colleagues who haven't had the same background as you. Yeah. Could you share some light on that?
100%. I feel, especially in surgical specialties where experience is all that matters. No matter how many times you read how to do the surgery, doing itself is a different ball game. So until and unless you have done several of these surgeries, you don't develop the finesse of work, or your hands don't know what to do during each step of the surgery. So especially in the surgical specialties, I feel Indian doctors are far superior to many other countries. And there are, of course, few centers of excellence in Europe and maybe in the US which are doing good amount of work and quality work. But in general, if you compare a surgical medical graduate in India with a surgical medical graduate elsewhere in the world, I don't think we lack anywhere.
So would you agree, right? The famous saying that you cannot learn swimming from reading a book. You just got to jump into the deep sea.
Absolutely, yeah.
What is the average day of yours? How does it look?
Well, my day starts at normally 6 in the morning, where my kids have to get ready to go to school, and then I have to get ready. So I do a bit of yoga. I sometimes play tennis in the mornings. So typically I leave home at 9 in the morning. The morning schedule is filled with surgeries. So as I said, we do at least 3-4 surgeries every day. Surgeries typically get over by 4:35, and then my OPD starts. So the OPD is basically consultations, and we do some non-surgical treatments like lasers or threads or Botox. So the OPD goes on till 9:30, 10 in the night. So typically I finish by 9:30, 10 in the night, and I reach home by 10:30. So that's the typical day.
So it's a very, very busy day.
It is, yeah.
Incredible. Out of your 10,000 surgeries and probably thousands and lakhs of patients that you've probably treated, one case that would you say was the hardest, and why?
There are several of tough cases that I've encountered, but one case that particularly comes to my mind is a child with microtia, that is an absent external ear. She was born without an external ear, and she had underwent I think 6 surgeries in Orissa, and at the end of these surgeries also the shape was not satisfactory. Now, to reconstruct ear in someone who has had so many surgeries, there are multiple challenges. The parents are exhausted financially. The child has suffered so much that whatever you are going to do now is the final option that the child has. There is nothing else that would remain. So we planned the surgery on a Sunday because I didn't want any other distractions during that day, and it was a 5-6 hours procedure. And for first 2-3 days it's unpredictable. Only when the bandages come off on the third day, you know whether the skin is surviving or whether the reconstruction is successful. So those 2-3 days were tough. But when I opened the bandages and when we saw that everything is looking nice, and when the parents saw the ear for the first time, I don't think those reactions I'll forget in my life. So that was something which was challenging. Yeah.
Very, very powerful. What did you learn from that case? So have cases like that come back? And they often say, right? I think life is about joining the dots.
Yeah.
So did you feel like that came back in some sense? What were the learnings?
It does make you feel more humble, and it makes you feel more gratitude towards what you have. I mean, you have to meet children who are born without a ear to understand, what they suffer or what the parents suffer. And so ear reconstruction, I feel, is one of the most satisfying surgeries that I do these days, and it's something which is incredible. Yeah.
Super, super. One thing that you shared a little earlier was, managing expectations of patients can get challenging, right? And couple of doctors that have sat in your chair in these conversations have also shared, right, that often patients blame the messenger, not the message.
True. Yeah.
Right? And so I think as a surgeon, your job sometimes I guess is also to communicate effectively to the patient, their families.
Yeah.
Have you encountered situations where there have been expectations mismatch? How have you dealt with it? Any advice to younger surgeons who are just starting off their practice?
Well, several times as surgeons and especially plastic surgeons, we deal with expectations all the time. Now, during the training itself, we are taught that you need to be able to identify people who have an unrealistic expectation. So there are a few no-go zones where you don't, operate on a patient till the time you're sure that the patient understands what he or she is getting into. You need to put it into their mind that surgeries are permanent. Whatever things are going to be altered, be it the bone or the cartilage, there is no going back. So until and unless you and the patient are at the same level of understanding or on the same page, you don't go to the second step, which is the actual surgery. So typically, I call the patients back for at least 2 consultations. So after the first consultation, I give them enough time to think about what all things have been explained to them. They may have some further queries, and then they come back to me. Especially for nose jobs where people have a lot of unrealistic expectation, I ask them to come back with photographs of maybe their relatives or some celebrity, the kind of nose that they want. And until and unless I am satisfied that this is something which is achievable or doable, I don't practice, I don't tell them that this is possible. So it is very important to deal with the expectations beforehand. Mm-hmm. Later on, of course, you only have yourself to blame if you have, sort of feeded on their unrealistic expectations. So it is our job as surgeons, as plastic surgeons, to bring the expectations to the ground, actual reality, and then take it forward from there.
Super, super. I think very helpful. So what is the most rewarding aspect of being a plastic surgeon?
Well, the most rewarding aspect is, of course, peer recognition. So if your own colleagues come back and tell you that, okay, now you are doing well in Bombay, and they feel that you are someone that people identify with, or tell them in their own cities that, okay, if I want to get any surgery done, I'll go to Mumbai and get it done from this doctor. So these feedbacks are something that are good to hear.
And I guess patients as well will probably appreciate you all the time. So it's incredible.
Yeah.
How do you think the field of plastic surgery is evolving, and where do you think it's going from here in the next 10-15 years? We keep hearing robotics, artificial intelligence. Is it really happening? Is it sooner than later?
Yeah. So plastic surgery, what was done 15-20 years ago and what it is done now, they are totally two different worlds. And similarly, I think 20 years down the line, what we will be doing and what we are doing now may be totally different. AI is still coming up in plastic surgery. Robotic surgery not as much, because plastic surgery does need a lot of individual artistry. Robotic surgery is good for surgeries which have fixed number of steps. Like you want to remove a tumor, yes, a robo can help you have more precision. But you want to create a beautiful nose, you need to guide the robo, what kind of nose to create. So wherever intuitiveness or wherever creativity comes in the picture, then AI or robotic things will still take some amount of time. But AI at the moment is helping us, show patients how their face may look after the surgery, how the nose may look, how their bodies will look. So currently we are using some softwares which are AI based, and they help us tell the patient what they can expect after the surgery. So it is helping us give more clarity to our patients of what they will have after the surgery. And in future, the trend is going to be towards minimally invasive surgeries, less downtime. So procedures such as lasers, threads, minimally invasive devices where the patient can come do the procedure and maybe go to office the next day. Those kind of procedures are on the rise.
Super. Thank you for sharing that. So once a surgeon in India completes their professional training, I think they face multiple opportunities or options, right? Government job, maybe become a professor, maybe private practice, maybe private hospital. How did you think of your career? And if you could share some pros and cons of each would be helpful for the audience.
Sure. So what happens is when you are graduating in plastic surgery, not all colleges give you a very huge number of cases to do hands-on. So it is always a good idea to continue in a government hospital or a municipal hospital at least for the initial 2-3 years, so that you get to perform more number of surgeries where you are actually responsible for the success of the surgery, not as an assistant, as the primary surgeon. So I would suggest that a few years as a doctor in a government hospital or a municipal hospital to begin with. Then a few years maybe in a group practice where 3-4 doctors, your friends or someone who you are comfortable working with can share a group practice, so that you can share the complications also. You can assist each other, and there is always someone to help you share the burden. And then private practice or being on your own is only when you feel you're sufficiently confident enough to handle complications, because surgery is not only the surgery. You need to be able to handle the complications of a surgery. So that normally happens, I would say, 5-6 years after your plastic surgery training. In my case, I initially was in the same hospital as a assistant professor for 2 years. And then when I came back from abroad, I started freelancing. So I used to, visit a few nursing homes, small hospitals in and around my residence, where I learned to do smaller operations on my own. And then starting my own hospital or a center happened later on in life.
So how do you handle the business side of running your own practice? The finance, the marketing, the compliance? How do you manage that?
So each aspect of it needs a specialist, right? So I have my clinic manager who looks after the compliance part. My wife looks after the day-to-day management. She's an anesthesiologist and we work together.
Wow.
So she looks after the man management or the staff management. And then the business side of it, I look into it myself, because I know what are the latest surgeries that are happening world over, what all were the number of procedures that we did last year, and what was the sort of trend that is picking up, what surgeries we do more often. So the business side, I normally deal with that.
Awesome. And I think they often say, right, medical professionals do not learn marketing in medical school. But it's an important skill set if you're building your own practice. I think today's modern day techniques of performance marketing, customer acquisition, maybe networking as well.
Absolutely.
How have you thought about that? How have you built that side of, that muscle which you probably weren't trained for?
So as you correctly said, there was hardly any training that we had during our plastic surgery residency. It was all by trial and error that I learned. So it's very, very important these days to market yourself properly. You may be doing absolutely phenomenal work, but if people don't know what work you do, it is not going to help you, or it is not going to in fact help the patients find a solution. For example, if I talk about microtia, where children are born without an external ear, there are very few doctors world over who deal with this surgery, very few plastic surgeons who deal with it, because it's a complex surgery, too many hours of operative time, long learning curve. So until and unless patients know that you are in India and you are doing something like this in Mumbai, why would someone come to you? So yes, showing before after photos plays a very important role in building the patient's confidence, attending conferences, webinars, presenting your work, and also social media is a very important tool. Of course, having said that, there are a lot of rules and regulations that we as doctors need to follow when we showcase our results on social media. But we are now at a stage where in each country doctors are showcasing their results. So if you want India to become a medical hub, or a hub for medical tourism, you can't escape the fact that social media is something which is very, very important.
And what mistakes have you seen, or what mistakes did you make in the early days while you were setting up the clinic? Maybe helpful for people who are in that phase today, opening their own clinic, that they can probably avoid these same mistakes.
Meaning, if you want to talk about the permissions that you need to open your clinic, be sure that you are aware of what are the norms that are required, the fire safety hazard norms, or any other norms like a stretcher lift being present in your building, because there are some things that you really can't change once you have finalized the location. Then accessibility is very important. You need to make sure that your patients are able to reach you. You may be in a good place, but if there is no accessibility, that doesn't help. So be sure to open a hospital in a place which is accessible. And of course, look around and then figure out which are the nearest hospitals to you. If you need any help in terms of a medical emergency, do you have a tertiary care hospital nearby where you can shift a patient in case of an emergency? So when you're on your own, you don't have a support system. You don't have 5, 6 other doctors, take care of your patient. You are alone and you are managing everything from admission to the surgery to the post-op care. So make sure you have a support system around you, and that really helps you in case of any kind of emergency.
Yeah, super. So, doctor, we know that you practice in Abu Dhabi, you shared as well. If today you're a medical professional with a practice in India and they want to consider, building a practice in Middle East, how do they go about it? What is the process? How did you do it?
So for the Middle East, especially for UAE, there are licensing exams that you need to pass. For Dubai, it is the Dubai Health Authority or the DHA exam, and for Abu Dhabi, it is the HAAD, HAAD, that is the Health Authority of Abu Dhabi. So these licensing exams have to be cleared before you get a license to practice in the UAE. So you need to decide which emirate you want to work in. After that, once you give your licensing exams, you need to also search for prospective employers. You need to find a hospital which would be interested in your skill set. Majority of the hospitals prefer full-timer doctors. So if you want to migrate, then it's a little easier for you to land a job. But if you are a visiting doctor like how I am, then it is there are not many job offerings for visiting doctors, and then it's all about having a good CV, a good reputation, and all that helps in ultimately landing a job.
Awesome. And what would you say are the key differences in the healthcare system in the UAE and India?
Well, some of the centers in India are quite good. They're as good as the UAE. But in general, the UAE system, follows the American or the European standard of healthcare. So in terms of the cleanliness or in terms of the norms that they have, especially licensing of doctors, so everything is very strictly regulated. So no, there is no quackery. There is no way that someone who's not qualified is going to perform that surgery, because everything is very, very strictly regulated. Apart from that, equipment wise, we are almost at par with the UAE. Of course, because the tax system is such that they get more companies interested in launching their latest inventions in UAE, because it's a richer market or more money for them. So the trends first come to UAE and then to India, or the machinery also first gets launched in the UAE, then in India. But given the social media and awareness that we have, not much of a time lag now. So we are almost there.
Awesome. I guess it must be really benefiting your practice to have such a diverse experience of technology, people, experiences, right? So you've treated several high-profile celebrities, you shared. How has that experience been, right? Because I think as a surgeon, as a medical professional, it's about managing patients, right? And sometimes if you have patients who are probably more publicly visible, can get a bit challenging. How has it been for you? Would love to hear, your experiences.
So operating on celebrities comes with its own challenges, as you said. So we need to ensure the confidentiality and the privacy. And then ultimately, you as a plastic surgeon, you have to get it out of your mind that they are celebrities. You need to treat them as normal human beings, as normal patients, because then by thinking about their celebrity status, you are just adding to the burden of care. Being a celebrity doesn't mean that your bone structure or face structure is different. It's just the same. So you need to separate the persona behind or what you see on camera with the actual person, and learn to deal with the actual person. So learn to identify what it is that they are looking for. Again, manage the expectations, and be very forthright and honest whether it is doable or not doable. So I sometimes get patients, who come looking after some kind of a trend. Like there's a trend for a fox eye effect or a cat eye effect. So it is your job to tell them that maybe this will not look good on your face, or maybe because you are already a known face and people know you, and then suddenly you start looking different, it is not going to be something which people will not catch up on. So do you really want to be in a scenario like that? So yeah, you need to guide them in a different way.
What has been the most fun trend that you have kind of treated, right? Where you're just like, oh my God, I did not even know this is a trend.
No, there are several trends. It's a never-ending thing. Every month you meet a new trend, and I always say that I learn from my patients. I learn about all these trends from my patients, because they have so much time to be on the social media and follow different trends. So there was a trend for a Barbie nose, and it's still there. So a Barbie nose is essentially a nose which is slightly upturned, and women, especially younger group of girls, they want this kind of a nose. Then, as I said, there was a cat eye trend which caught on, I think, because of Kylie Jenner, if I'm not mistaken. Currently, people are raving about a few other celebrities. So the trends are something, I think, which will keep changing with flavor of the season.
Yeah. Switching gears a bit, orthopedics as a branch is notoriously known as a more male-dominated branch with very few women representation. How is the split in surgery?
So in surgery, when my bosses were residents, there were hardly any females opting for surgery. And during the time that I trained, we had, I would say, 70% males and 30% females. And currently, in fact, we had a reunion at my medical college some time back. It is completely reversed now. So 70% were women and 30% men.
Oh wow!
So more and more women are opting for plastic surgery, and it's a very heartening scenario. So yeah, things are changing.
There are many young interns today who are looking up to medical professionals like yourself, who want to take up surgery. What should their mindset be? What should they kind of look to kind of develop while they are preparing for the NEET PG that could set them up for success if they take up surgery?
It's a very good question, and I would say the most important thing is, you need to be very hardcore surgeon to aspire to be a surgeon. Because surgery is not easy. It is something where you have to get your hands dirty. There is no other way you learn surgery. And by getting hands dirty, I mean your work hours can be anywhere between 36 to 48 hours. At a stage, there were several months where I hardly got to sleep more than 2 hours during my plastic surgery. So you need to be tough. It is not for the weak-hearted. And secondly, you need to stop comparing with your peers. Don't think of engineers who have graduated along with you and they're already earning in 6-digit, 7-digit kind of salaries. That's not the way to go. As a surgeon, you need to be focused on your own growth, and not compare your journey with others, because what people are achieving at the age of 25 in other fields, you may be achieving at the age of 35, because it takes a very long learning process to become a successful surgeon. But having said that, if you really like what you're doing, then you will not regret that decision, because it's not really about the destination, it's about the journey. So you need to learn to enjoy the journey, and then you'll automatically reach the destination.
Super, very helpful. I'd like to shift gears a bit. I think we spoke about this a little earlier as well, on what is sometimes the psychological impact that patients are looking for when they come to a plastic surgeon like yourself, particularly when they're coming for a cosmetic surgery? I'd love you to share some light on that.
So patients always want to become the best version of themselves. Now, whether that best version of themselves is something which is achievable, that is for you as a plastic surgeon to be able to see. There are sometimes procedures which need to be staged. So it may not be one single surgery which will take them to their ultimate destination. So you need to be able to tell the patients that a surgery will take you from point A to point B, but then you may still in future need something more. Even for patients who come for weight loss or for body contouring, they shouldn't be looking at the surgery as a shortcut to becoming slim. The surgery is to remove the excess fat and to get them into a better shape, but they need to eat healthy, they need to exercise, and this has to be drilled into patients. That surgeries don't mean that they are like going to a mall to do some shopping. They need to have their own recovery time. A surgery needs to have more awareness from the patient's side, maybe a lifestyle change, and only all of this combined together will help them achieve what they want. It can't be only the onus on the surgeon to do everything and the patients don't need to do anything. It doesn't work like that.
I really appreciated that lens, right, Doctor? But I'd like to also take a parallel lens. Today we are seeing thousands of medical professionals who are facing significant level of mental distress, right, where they're not feeling good about themselves, right? The process of studying for years on end, right, when your colleagues and your friends from other specialities, maybe engineering and finance, are living a very different life. What kind of advice, what kind of lens would you give them? Because you're somebody who's actually made it, right? And they look up to people like you, be like, yes, we want this life, and that's why we're working towards it.
Well, if you want to opt to become a doctor, you have to be crazy, okay? So that craziness or focus on becoming a doctor is something which you need to have. It is not something which is a passing fad and you can quit being a doctor after a few years. It doesn't happen like that. So unless you are ready to go through the grind, this path is not for you. But then if you really have empathy, if you want to help people, or you are comfortable having a patient-to-patient interaction and you like dealing with clinical scenarios, then it's not a bad profession. It's a tough profession, and mental breakdown can happen because your time doesn't remain your own. You may have some family commitments, you may have some wedding to attend, and you are just not able to get off your work and reach there. So you need to make compromises with your family life, with your social life, and there is going to be a price to pay for everything that you want to achieve. But then if you really strive to be balanced in your work and family life, then you can manage. It's something which ultimately is something you need to deal with at each individual level.
Got it. Switching gears a bit, you come from a family of doctors. You said your parents are doctors, your wife's a doctor. How has that been? And the real question, do you want your kids to be doctors?
So that's a tough one. Okay, my daughter is now appearing for her 10th exam.
Oh, so it's getting there. So the decision is coming.
So we try to, be very neutral about it at home when we talk about our professions with our children, because they see the lack of time that I have to give them, and they see the kind of struggle it is always to maintain a family life. But then it is something that they have to arrive at their own conclusions. Being from a family of doctors doesn't mean that your child has to become a doctor. I have several of my friends whose kids have not opted for this profession because it's a tough profession and they don't really want to go through the grind. So it is not something you can force upon somebody, and until and unless they are sure that they want to get into it, I don't think we should force them.
I'd love to talk a little bit about personal finance. It's a topic that is of great interest to young residents and senior residents, and somebody who's built a thriving practice, who has multiple sources of income, would love to hear from you on how do you manage your personal finance and any advice you have for residents. and young doctors?
Well, you need to start saving from early on in life, and whatever you have in terms of an excess income, don't splurge it on things which are unwanted. And it's better to save, invest in whichever form of investment option is sensible to you. If you want, take professional help, because there are a lot of professionals now who can manage your personal wealth. They can manage a lot of other things and aspects of life. So take professional help, because as doctors we are not really trained in finance, and we don't know how to manage our resources. So that's what I do. I have someone who's a professional who's helping me with my finances, and it's the best way, I think.
But anything in particular on what percentage you should try saving, or how you've tried to, what kind of, securities you should invest in, equities, debt, outside India, anything that you've thought of that could probably give some advice?
So equities is always, if you want to multiply your income, equities is a good option, but at least 20% should be in debt. Then if you have any other sources of income, it's always better, don't rely on one single source of income. There are doctors who have opened several different aspects like farming. There are a lot of things that you can do, so that don't put all your eggs in one basket. Spread it around, and then it becomes safer in terms of managing it.
One final question from my side. I think the bedrock of medicine is a successful and trustworthy relationship with the patient.
Absolutely. Yeah.
Right? And you're in a profession, particularly within plastic surgery, where things can be expected to be confidential. How have you managed this trust with the patient? And any advice for, again, younger doctors, nurses, technicians who are looking to build this out?
I think honesty is the best policy in this profession. You can't be dishonest in terms of recommending treatments which are non-scientific, or so I get a lot of patients who come seeking options, and sometimes I feel they are not good candidates for it. They are so young, and why they would want to do something like Botox? So I refused to treat them. I said, you don't need this at the moment, and go back and come back few years down the line. So they really admire my honesty, and then they really appreciate that, okay, this is a doctor who's actually turning me back and not looking at me as a source of income. And that is how I feel you should practice. Don't go for unscientific claims. Don't go for treatments which are without any scientific basis, and don't claim things which you can't deliver. That's the main thing, I think.
Yeah. I'd like to end it with a rapid fire.
Sure.
And we hope to make it as quick so it's fun. One plastic surgery procedure that still fascinates you.
Ear reconstruction.
One celebrity you wish you can work on, hypothetically.
Kriti Sanon.
Which is one doctor that you'd love to collaborate with, maybe like a senior surgeon or any other practice?
There are a few, yeah.
You want to name one, maybe?
Dr. Mike Nayak.
Why?
He's very good in deep plane facelift. He's from US. Something very different, yeah.
Super. A surgical skill that you mastered but you wish you had learned earlier?
Deep plane facelift.
India, UAE, which is the more challenging country to do medicine in?
Both have their own challenges. You can't really compare. India, I would say, yeah.
One plastic surgery trend that you think is overrated?
Several.
No one. You have to name one, doctor.
This trap talks. Trap talks is basically Botox, where Botox is injected in the shoulder muscle to make the neck look longer. I think it's overrated. Don't do it.
The most rewarding part of being a plastic surgeon?
Patients trust, and sometimes when patients, compare you with God or something like that, that's unreal. Yeah.
If you had to swap places with one non-surgical branch, which would it be and why?
Probably I'll be a dermatologist. I don't know. Something similar to what I'm doing.
It's been an absolute pleasure, Dr. Parag. Learned so much. I had a lot of fun. Thank you so much for being part of Behind the Scrubs with Knya. Any questions that you have for me? Anything that you'd like for me to answer?
It was a pleasure for me to be on your podcast, and I feel you're doing a great job in creating awareness amongst young medical professionals or paramedical branches, because people just see the glamour. They don't see the grind that has gone behind it, and until and unless people are more aware of what challenges we as doctors face on a daily basis, they will not have more empathy towards the medical professionals. It is not an easy branch, and if someone is looking at it as only someone who's here to make money. That's not how it works. Each profession makes money, but doctors also contribute a lot to the society. And it's important for the society not to forget that. If you don't have good doctors, where will you all go?
No, absolute pleasure, doctor. So I think when Vanshika and I co-founded Knya, I think the intent was very clear. We wanted to build a brand that could celebrate medical professionals, right? Doctors, nurses, technicians. We often feel that sense of respect in some sense has gone away, right? Amongst the general public, but also amongst medical professionals. Yeah. So we felt if we could have a platform where we can have honest conversations and through our scrubs, speak out and share messages that can create a difference, why not? And I think it's been 3 years that we've been doing this, and I feel like we've made some impact, right? So it feels good when we go back home every day, right? That we're supporting and empowering doctors like yourself who wear scrubs and can perform these surgeries that make lives better, make people feel good about themselves.
You're doing a great job.
Thank you, doctor. Thank you so much. Thank you, everyone who watched. Please like, share, and subscribe. If you're interested in surgery, and particularly plastic surgery, this episode is for you. Dr. Parag comes with a wealth of knowledge and shares some very interesting insights. Excited for you to watch and share your feedback in the comments below.